One thing that feels important to me, and maybe hopefully this is something I feel that's been echoed here, is a central question is what differentiates Ayurveda from allopathic medicine? That feels really fundamental, no? In the sense of if there's this desire to integrate Ayurveda with allopathic medicine, then there's something unique that Ayurveda is offering, and where that is obviously part of that's the herbal materia medica. It's not only that, you know, because if it was only that, then there would be no need for it after those things had been kind of integrated. Yeah, so I think that's perhaps already obvious to many of you. And I think an extension of that, part of that relates to obviously this thing around creating awareness, education, and which comes to both practitioners, government, all we've kind of talked about across the whole sector of society, you know. And one of the things that's been touched on a little bit, but this thing around self-management, self-care, community aspect, and of course that relates to this notion of, at least for me and my very tiny experience of Ayurveda, is this kind of sense of embodiment, like how it connects me in a way to my own ability to discern what is healthy for me, in a way, and not become completely disempowered by and be empowered by my engagement with practitioners, doctors, whatnot, you know. And that's something that I personally feel that's very lacking in allopathic medicine, where one becomes very dependent on the doctor, in a sense. So it can be in terms of like diet, you know, oh, I have a sense of like I'm desiring something sour. That's telling me something that's going on in my body that I need. That's not something that I ever learned through my education in the UK or allopathic medicine. That's different, right? And I think we can turn these things into technological instruments that can be helpful, but that if we only do that, that is not necessarily, in my view, offering something different. It is in a sense, you're adding in new materials, you're adding new technological and pharmaceutical interventions, but there's also something then the uniqueness maybe of the philosophy of Ayurveda is then lost. So for me, that feels really important on kind of multiple levels in terms of education, awareness, the relationship between practitioner and the public, whatnot. Okay, so then I'll just give a few kind of practical things, kind of maybe building on that. So there are many different words for talking about this: interests, needs, demand, awareness, maybe. So I guess one aspect is what are you wanting people? What are people calling for? What are you needing? There's been some talk about a large proportion of doctors and also patients. People draw on herbal medicines, Ayurveda, yoga, meditation. That's obviously about physical and mental health, but it's not only about those things. It has a social element, has a spiritual element, maybe even an ecological element. That is something that is very much embedded in Ayurvedic philosophy. In biomedicine, it's, you know, emerges through adding on all these other things like planetary health and something like that, but it's not something that's necessarily present in mind when one is going for a medical appointment. No? Yeah. So so I'm just thinking about that when we're talking about what is demand, what is required. No? So I think just on this notion of demand, like was mentioned a couple of times, patient groups, interest groups, advocacy groups. There's a lady, I think she's not here, from the North Indian, South Asian or Hindu Association. So that's another group. These kind of groups where there's an interest in this, there's maybe even a familiarity with this, being in the way that happens with pharmaceuticals. You know, there's a rare disease, they create a group interest around it, that creates a group, that's a group that's representing a demand. No? So that's a point of advocacy. Perhaps in terms of pharmaceuticals, but also for education. Also, there's probably and could be bodies of research done on the uses of these things already in the UK and the desires for these things, you know, or that becomes another kind of layer of evidence to contribute to their interests. Then in terms of regulation, what was mentioned a couple of times was the importance of changing the medical, educational, regulatory bodies in terms of what place Ayurveda, other kinds of non-allopathic medicines are given there such that they become mandatory parts of curriculums. And to what degree that is obviously up to debate now. And I'm just listening, so I'm not saying I've seen research. Also mention of national standards and practices, accreditation for quality practice. Importance of addressing this notion of the GMP and what that means, how other countries, including India, relate in relation to herbal medicines and synthetics. I just mentioned saying around educational curriculum. You also mentioned that. Ladies can also mentioned that the importance of shifting that and the differences of how we can shift our own perspective, depending on where we are in our life. Creation of public courses, which could provide lots of funds and also building awareness. I've just got a few more points. So I think this thing around research and evidence seems very important. What is constituted as evidence and what people value as evidence is really fundamental in a lot of this debate. There's a whole, I guess, colonial history about what kinds of evidence we seek and are needed to prove the validity of particular kinds of health practices. And for me, what Dr. Merlin Wilcox talked about in terms of prejudice-based medicine really caught me that term is quite a very nice play on words in a sense, but it also I think cuts really deep in the sense of, for me, that notion of prejudice seems to kind of map onto historical assumptions of why one medicine gets called traditional and another gets called modern and contemporary. Obviously it's not so black and white, and neither is it both, but that feels really important, what it means to challenge that. And I think I have some ideas on that, which I'll put in the notes. Obviously different kinds of, there's obviously the emergence of different kinds of disciplines like genomic, and there was talk of large living labs and different ways of building evidence. And I think what I talked about in terms of my own experience, like what is evidence for me of that this thing works. Well, of course, I will read papers and stuff like that, but I also want to see and be able to notice how it changes my own experience and my own sense of health. And that is something that's not, I've had to learn to do that because the educational system in the UK doesn't train me to be aware of my body in some ways. In many cases, the educational system trains me to be disembodied because I need to force myself through a system, So I think that's a kind of another aspect of evidence, and so how to work that into it as both something that's valued within proving something is true and also as something that people are taught to learn for themselves. And that, I think that's a part of the role for social sciences and humanities, engage in that aspect of things. The mention of the Indian government's this is more on the pharmaceuticals, the Indian government having a large database on materia medica and for pharmaceutical exploration. And I would add also the questions around the ethics of and politics of property and what those things then implicates for people's access to medicines. Herbal medicines are already existing and used around the world. That poses problems for funding. So maybe there are different kinds of funding models for that. Wellness centers, that could also involve food and yoga and meditation as places where people can access that are not maybe under GP settings. So there's maybe a bit more space for wriggling around things. And that's both the source of raising awareness, people accessing and kind of engaging with their health, and then funding perhaps. And then all the different kind of sources of funding that was mentioned. So that's what I have here. Okay. Thank you very much.